Next up, we have Bishen Singh from Microsoft, and someone who's also done a lot of government work in his career. If you could look him up on LinkedIn, you'll see he's not only worked with the HHS, but also with NIH, and has a deeply rooted understanding of healthcare system. Hi, Bishen, how are you?
Hi, Stan. Great to see you. Nice to be here.
Good to see you too. And either you have an amazing kitchen or you have an incredible background for your Zoom filter. What is that behind you?
There's a nice fake background I have of this my favorite coffee shop.
Your favorite? Okay, there you go. I was going to say that looks very nice. Well, again, first of all, thank you for your time. We know how busy you are in this day and age. And second of all, if you could just provide a little bit of background for the audience, a minute or so about your journey into healthcare and certainly in digital healthcare.
Sure. Yeah. So I trained in neuroscience and data science and started my career studying behavior, learning, and memory while I was working on animal models in a lab. I'm fascinated by how the brain works, so my goal at the time was to better understand it. I learned a lot, but I'm not sure if I have more questions now about the brain than I did back then, so the journey continues. But after the lab, I spent a couple of years at the National Institutes of Health, as you mentioned, where my team and I were funding brain research. So this meant giving out grants as a part of the Brain Initiative, as well as to other researchers who were leveraging stem cells to study disorders like depression, bipolar disorder, schizophrenia, things like that. And my focus was really around the data integration component of these efforts, which led me to my next role, which was at the Department of Health and Human Services, just like April. So I worked on two main challenges there. One was incentivizing cross-department alignment of social determinants of health-related program dollars, and then enabling department-wide data sharing. So these, as April mentioned, these were and still are big problems to solve, and the efforts are ongoing. So imagine if you're at the CDC and I'm at the FDA, and we're both working on something towards figuring out a solution to the opioids epidemic. How do we figure out that you have this data set, I have that data set, and bring them together to do something more effective together than we otherwise would do separately? Along the way, I got an MBA from Georgetown University and landed at Microsoft, where I'm now focused on developing strategies for our clients in the health and life science space. To leverage the cloud, Azure, and related tools in order to work more efficiently and intelligently, and while doing so, improve health at the population level.
Okay, that's fantastic. And, I think, obviously you're doing a lot with Microsoft these days around the digital transformation there. Talk a little bit about what that looks like and how that's impacting and how you think that will impact access and equity in the healthcare system 5 or 10 years down the road, given Microsoft's really pervasive impact on healthcare these days.
Yeah, so we're doing a bunch of cool stuff. So I'll start with the access front. So we're working towards enhancing some of the capabilities of ordinary sensors. So to take webcams, for example, to measure, let's say, like physiological signals like peripheral blood flow, heart rate, blood pressure, things like that, so that in areas and settings where medical devices aren't available, care providers can use webcams and maybe even their smartphone to assess a patient's condition, which makes access much easier. The same technology can also be applied in the case of remote care delivery. So care providers can converse with patients and get data on their condition simultaneously and without having to meet them in person to check their blood pressure. So this is a huge advancement that I'm really excited about. We're also partnering with other companies to leverage Azure as a platform for accessing and analyzing health data for use cases that connect with real world data. So let's say facilitating access to remote care, supporting decentralized clinical trials, patient matching, things like that. Nuance, which is a recent acquisition for us, can be leveraged to reduce provider burnout. HoloLens can be leveraged for more precise surgeries with the help of augmented reality. So bottom line is patients can get access to better quality care and therefore benefit from better health outcomes. And then on the equity front, one example that comes to mind is we're addressing important issues like why we see certain inequities in healthcare data. So I think someone mentioned this earlier as well. So machine learning methods, we're developing some machine learning methods now that make it easier to understand what machine learning models have learned and then provide tools to mitigate things like bias, which traditionally have made some of the health outcomes less than ideal. So those are a couple that we're prioritizing and that are really exciting to me at the moment.
That's amazing. That's really spot on and not surprising, just given Microsoft's long-term commitment to healthcare, going back to just supplying hospitals all over the country and really around the world with a lot of their real basic office systems, and then running the Microsoft Health Vault for several years, and then eventually just what we're seeing now with the kind of work that you're doing as well. And just to wrap things up, we've got about 2 or 3 more minutes here. What do you see as again, given all your work in the federal government side, as some of the major initiatives and really the major steps that the federal government is doing, either vis-a-vis the NIH or any one of those 24 agencies, or the CDC that we just talked about with April, or the HHS rather with April, and then even the CDC. And we have some folks who are listening in the audience from the CDC today as well, from Atlanta. What do you see as some of the major initiatives that are making a difference in access and equity for a lot of the folks that have just not been able to be really added to and be taken up with this digital health revolution that we've seen, particularly over the last 3 years?
Yeah, that's a great question. So firstly, the 2 ARPAs. So one, April mentioned ARPA H, Advanced Research Projects Agency for Health. And then the second one is the American Rescue Plan Act of 2021. So ARPA H is still in the process of being stood up, but Francis Collins, the director of NIH, and others have already described in detail the need for ARPA H to target vulnerable groups, not only because that approach is necessary, but also because that approach will likely improve care for all patients. So this means that there could be a shift in terms of the way certain patient groups are prioritized. So traditionally, when the largest or most strongly affected groups are prioritized, could now be moving to the most vulnerable or rare disease groups being prioritized. So that's an exciting shift that I'm seeing. So the other ARPA, just the American Rescue Plan Act, the one without the -H suffix, they're focusing more on the SDOH side of things, so social determinants of health. So funding community-based organizations towards advancing racial equity, literacy, whether that's health literacy or digital literacy, and other important factors related to access and equity. I think that's an important shift as well that we're seeing, and important work that the federal government is supporting. On the HHS side, some of my former colleagues recently created a new office called the Office of Climate Change and Health Equity. So I think, health equity at the intersection of X, Y, and Z is going to be a really interesting trend to follow. So this office's goal is to serve as a hub for climate change and health policy. And I think what they're working on is environmental justice and equitable health outcomes. So communities in areas where they're exposed to pollutants, where hotter temperatures, the risk of power outages, flooding, things like that, put them at risk for worse health outcomes. So I think that intersection of health equity with other trends is an important one to follow. And then lastly, I'll just wrap up with the private sector side. We see companies connecting social determinants of health data with clinical data. And this is a hard problem to solve because it's tricky to attribute the success or even failure of an intervention there with a change in a clinical outcome measure. But it's super important because if it works, then people like payers can create programs to prevent negative health outcomes and incentivize patients to take certain actions that'll improve their health. So it's an exciting time to be in the space, but then again, it's never not exciting to work at the intersection of health and technology.
Yeah, absolutely. And again, thank you for your time today, Bishen. Just great comments and very insightful thoughts about what's happening with access and equity. Thank you.
Thanks, Dan.
So we are just trucking. That is the end of hour number 1 on this 3-hour journey here today to cover a number of issues in access and equity. And I really, again, want to appreciate the hundreds of folks who are tuning in from around the world. And we know that you're busy as well. And by the way, we will drop in the YouTube channel for HITLAB. If you miss any sessions today, if you can't make the entire program, don't be afraid to subscribe to HITLAB's YouTube channel and to have that up and running as well. So you get videos as they drop afterwards. And then also would like to remind everybody who is at the symposium today, this is a special chance for you to enroll in the Digital Health Strategy Program happening November 20th through the 29th, excuse the typo. Again, September 20th through the 29th, the Digital Health Strategy Program. You can certify from Columbia Business School in the Digital Health Strategy Program at Columbia Business School. It is virtual, it is online, you don't have to go anywhere, you can take it from anywhere in the world. It is 11 a.m. to 2 p.m. each day. Tuesday, Wednesday, and Thursday only. So 3 days week 1, 3 days week 2. And you can enroll today for just $4.99. Again, we love to have people enroll from communities from all around the world. And we know a lot of you can really appreciate the $4.99 cost for certification from Columbia Business School relative to the usual price of $5,450 to certify from Columbia Business School in the digital health program. So again, look in your chat box. Jerry has dropped into the chat box the instructions and the discount code, which is very important to use in the payment side of that transaction. And again, it's just for today. So do enroll today if you are interested. You can find out more about it online. Otherwise, again, feel free to email me or link in with me, and happy to send you more information as well. But we also want to remind you that there is a meet and greet after this session. So do, again, use the Zoom link that Jerry just dropped into the chat box as well for that meet and greet. Also, we have one more book giveaway. Pop in your answer to this for your own personalized signed copy of the Double Bottom Line from Donato Tramuto. According to the CVS 2021 Healthcare Insights Study, what was the most important factor for when engaging with healthcare according to US adults? A, ease of access, B, data security, C, coordination of healthcare provider, or D, healthcare costs. So again, you're the first one to answer this correctly gets their free digital health, their free copy, hard copy of the Double Bottom Line. Again, according to the CVS 2021 Healthcare Insight Study, what was the most important factor in engaging with the healthcare system in the United States for adults? Access, security, coordination, or costs? And the answer, of course, is ease of access, the actual title of this program here today. So again, the first one to enter that into the chat box is the winner of a personalized copy for the Double Bottom Line. Again, tremendous to see that happening.